Hello everyone and welcome to this afternoon's webinar on the University of Liverpool's MSc Health Psychology programme. My name is Ben and I work in the marketing team. I'm going to hand over shortly to Dr. Louise Roper, who will be presenting today's webinar, joined by Stephen Livesey, our Director of Learning Technology, and Joe Shaw from our admissions team. The session is being recorded and the recording will be shared with everyone who registered for this event. For those who haven't attended a Zoom webinar before, you can ask questions during the session by clicking on the Q&A button towards the bottom of your screen that you will see if you move your mouse or your cursor. You can also use the chat to ask questions as well. So we will go through and answer any questions you have at the end of this session, but do feel free to ask those as we go along. We will review and answer all of those at the end. So I will now hand you over to Louise and start the session. So Louise, over to you. Thank you.
Thanks, Ben, and thanks everyone for attending today. So I'm Louise Roper. I'm the Programme Director of the MSc in Health Psychology. I'm a lecturer at the University of Liverpool and a health psychologist who works in the NHS in the UK. Today, what we're going to talk about is, first of all, touch on the Department of Psychology at the University of Liverpool, and then I'll give you some more detail about the Masters in Health Psychology. And then Stephen will talk about the virtual learning environment, and Joe, the admissions and enrolment processes. And then any questions you have, as Ben's already said, please let us know and we'll all do our best to answer them for you. Okay, so here are some stats, some facts. Can we just go back a slide?
Sorry, yes.
Okay. Some facts and stats about the university. We have 8,000 international students at the University of Liverpool, 6,000 staff. We have 33,000 students in total, of which 10,000 of those are online students. And we've been running online masters for a very long time. Liverpool is the original red brick university that was founded in 1881, and we are a Russell Group university as well. The Department of Psychology has been offering online postgraduate courses since 2006, so we're well versed in how to run these successfully. And in 2019, we started our new partnership with Kaplan. So this is one of the first exciting programs to come from that partnership. Okay, so a little now about the Department of Psychology. So I've been at the Department of Psychology for 16 years, and we provide a range of BPS accredited programs that includes undergraduate programs, postgraduate programs, research methods, masters, occupational and organisational psychology, and also forensic psychology. So we have lots of experience in BPS accredited programs, and our students benefit from an immersion in world-leading research intensive environment. So around 30% of all the research conducted at the University of Liverpool is quantified as world-leading, and around another 50% is nationally and internationally recognised as excellent. So we're all very heavily involved in research, and you will benefit as a student from cutting edge research and knowledge and skills developed from researchers who are really leading their fields. Our philosophy is to provide a research connected student experience, and that combines both active learning and authentic assessment. So research connected teaching, what is this? So this is where researchers in the field, experts, try and develop content and teach and lecture students in what's happening and what's the most up-to-date goings on at the moment. And in health, that's really, really lots of applied research. We have strong within our department, we have strong research groups focusing on addiction, health, forensic, cognition. There's lots of different types of research groups within psychology in our department, and we really encourage that research to be taught to students as quickly as possible, really. So that research and that student experience is very connected. And then just touching on authentic assessment. This is important for all of the courses that we run, but particularly in health psychology. What we want students to leave the programme with is the skills and the knowledge, and if possible, the experience to be highly employable and to be able to use the skills and the knowledge that they've developed in practical environments. So that might be working in psychology in the future, further study, or other types of workplaces that you might want to go into. So to do this, we make sure that our assessments are kind of real world assessments. So it might be that we ask you to do presentations, conduct literature searches, interview people, work on data that's collected from, real projects. We might look at policy and synopsis of policy documents. There's loads of different ways that we can make our assessments not just academic, really real world applied assessments. On completion of your studies in the Department of Psychology, you'll graduate with an MSc in Health Psychology, and that applies to everyone. Okay, so why choose the Masters in Health Psychology? So as I've already said, students will leave with a master's level knowledge in health psychology, which will equip them with a stage 1 health psychology qualification, and that's if they have the graduate basis for chartership. Our BPS approval is pending at the moment, so we're waiting on final comments and final sign-off, and we're confident that that will be in place for our January admission. Students will be interested in developing a critical awareness of current, local and global issues, and also developments in health promotion, illness prevention, and also interventions. As you will know, if you want to study this course, health psychologists are the only healthcare professional group trained to a doctoral level in behaviour change interventions. And as you will know, we work in a range of settings and with a range of problems. Health psychologists typically work with people who've got illness or long-term health conditions, as well as people who are currently physically well but want to improve their health. So this idea around interventions is really important, and it's important that we cover lots of different types of behaviour change interventions, and also ideally we cover some therapy skills as well, and we have modules that look at both of these things in great detail. Interventions could be as varied as increasing exercise or increasing healthy eating or smoking cessation groups, but it could also be around conducting therapy with helping people to cope with chronic pain. And as you know, we work with individuals, groups and organisations, so we want to develop your skills in doing this as well. In addition to intervention work, we need to have a high level of skill in research and also in other kinds of academic environments. So we want you to excel in academia or further study if you choose to go on to be qualified, teaching, research, clinical practice, or health psychology related patient work. There's so much that we cover. And as I say, I work really quite closely with the BPS, and also looking towards stage 2, we know that it's really important that this stage 1, this health psychology masters, equips students with the skills that they need to go on to be a trainee psychologist if that's what they'd like to do. And we've really developed this programme with that in mind. So we have lots of clinical skill practice. We have lots of workshops which will enhance your skills in lots of different ways. And also we touch, as I've already said, on the academic and the research and clinical practice aspects of your professional development, really. So what will you learn? So you will focus on chronic health issues across the lifespan, both locally and globally. So although it is a UK-based course, we do always try and look at the global health perspective of various things. We have modules. Of course, we start with a fundamental issues module, which is an introduction really to health psychology and all the models that we will discuss and talk about. We have research methods modules, both qualitative and quantitative methods. We then have a module that looks at cognitions and illness beliefs. We have a module that focuses on health across the lifespan, another that focuses on behaviour change interventions, another that focuses on long-term conditions, and then we also have a professional issues module which really focuses on skills that can be developed for everyone, and also skills that are developed as part of that professional practice. We think that behaviour change interventions are crucial to the work of a health psychologist, and actually many masters don't focus on this. And because that's such a strength with the staff that are involved in this programme, we thought it was worth developing a whole module on this. So there's lots of chance to learn more about this, and that will be developed and delivered by health psychologists. So as I've already said, we have an understanding of therapies. So I know that we cover ACT, CBT, compassion focused therapy, motivational interviewing, goal setting, that type of thing. We also have the chance to practice our skills, and that's not just in one module, that's throughout the programme. And we give you techniques to use in practice as either self-care or care with patients. Okay, and then finally, we've got our careers and skill development, which is really important because particularly in the UK, there's it's a muddy pathway of how to become a health psychologist. There's many different routes that we can take. And obviously lots of people that take this master's won't want to do that. They might want to go into a career in clinical psychology or counselling psychology, or just mental health, physical health, or many other different types of areas. So the way that the course is set up, we have 1 hour of lectures every week, and that's over 8 weeks. So 8 weeks per module, 1 hour of lectures. We then have a 2-hour student-led seminar where you work on something set by the lecturer, maybe in groups, maybe in pairs, or maybe alone. And then we also have a 1-hour skills workshop every week. And this will either develop skills that will help you pass the assessments and the assignments as part of the modules, or it will help you develop skills in research or clinical practice. We also have skills workshops around professional development, so things like reflective practice and how to do that well. There's regular reflective practice throughout the programme, and this actually accounts for 10% of the assessment for all of the modules. And we have teaching, where we teach you how to do that and why you should do it in particular ways, and then we practice this throughout the whole programme. It's really important for health professionals to engage in regular reflective practice. We also have discussion boards, which we expect to be pretty lively. We'd like you to contribute to these as often as possible, but there's 3 set times in each module where you'll be assessed with around your contribution, and this is where the lecturers will really be on top of this and kind of contributing to this, and it'll be nice as a sort of team building exercise as well with the other students in your class to all get involved and discuss things together. And as I've already touched on, we have the authentic assessments. So, career development wise, by taking this programme, you will have started your journey towards either chartered status or at the very least enhanced your knowledge and skills in health related psychology settings. So we do think it's a win-win for anyone who's interested. Oh, that's me. So thank you for listening. I'll be here right until the end to answer any questions. I'll pass over to Stephen now, who's going to talk us through the virtual learning environment.
That's great. Thanks, Louise. So hi, everyone. Thanks for your time this afternoon. In this part of the presentation, we're going to look at the virtual learning environment. And in a moment, I'll just share my screen and actually show you the learning platform and hopefully give you an idea about what it's like to study online with us. So if you give me a moment, I'll just share my screen. And hopefully you should be able to see the learning platform there. Okay, so yeah, in this part of the presentation, I'm going to log into the platform as a demo student and just walk you through some of the key features of the platform. But I'll also talk a little bit about how we present the content. So Louise mentioned there some of the key features within the modules. I'll show you a little glimpse of some of those materials, just to give you an idea about what it's like to study with us online. So first of all, this is the learning platform homepage. And I suppose the first thing to mention is that this is all responsive. So you can access on your mobile phone, your tablet, laptop, wherever you are really. It's also a central platform to access everything you'll need for your program of study. So there are lots of resources and services that plug in to the platform behind the scenes, but we give you everything you need through one central space. So for example, you'll also have access to the University of Liverpool online library, but we can direct you to that through the platform. So you don't need to remember lots of different spaces to go to. So on the platform, you'll access your lecture materials, your assessments, your group work, discussion forums, all within your taught modules. Okay, so this is the homepage, and I'll click on Get Started here, and I'll go into one of the demo modules we've got. So every student has their own student dashboard. So although it's one central platform, it's actually personalized to your student experience. So for example, any deadlines that are relevant to your taught modules, any particular milestones or schedules are all presented to you in your personalized calendar and personalized dashboard. So for example, this demo student has been tied to this first module here, which is the fundamental issues of health psychology. And I can also keep track of my progress within that module from this dashboard page. So I'll go into the module and show you what it looks like. This is the module homepage, and in the center of the page, we have the content. So on the homepage, we have some introductory text, and we have the learning outcomes for the module. And on the left-hand side of the screen, we have the navigation. And in a module, this is fairly consistent. So the idea being that it's fairly intuitive for you to use the platform as you work from one module to the next. So you don't need to relearn how to use the platform each time you take a new module. I should also mention that before you take a taught module like this one, you'll have a 2-week induction right at the beginning of your program. And in the induction, there'll be some introductory material on how to use the learning platform. So, you know, how to contribute to forums, upload your work, how to contact your lecturer, and so on. And so when it comes to your first taught module, you should be quite comfortable with the learning environment. So on the left-hand side of the page here, I'll work through some of the key pages. First of all, you can see this module has been split over 8 weeks. So it's a 15-credit module split over 8 weeks. And I'll go into a week of study in just a moment. But before I do that, I'll go into some of these core pages at the top. So first of all, every module has a lecturer, and the lecturer has their tutor office. Now this is just a demo module, but here you'd see the real name and contact details for your lecturer within the module. And the lecturer's role is to provide any academic support that you might have within that particular module. So, you know, you'll have questions about the content, perhaps about the assignments, about some of the materials in the lecture casts, and your lecturer is there to provide that academic support. The lecturer will also contribute to discussion forums. They'll give you feedback on your assignments, they'll grade your assignments, and be there to support you through the module. Now, you'll probably have a different lecturer in each of your taught modules, as they'll be specialists in that particular field. But the constant support that also wraps around the whole program comes from our student services teams. And there's a student support team who will be there to help you through the entire program. So they'll be able to provide any pastoral support or any support around the program as a whole that might not be an academic query. So you'll have that support there for you as well. Okay, on the deadline details page, the next one down, we have a schedule for the module. So on this page, we've highlighted the key milestones. These are the summative assessments throughout the module. So in this one, we have some discussion forums, there's a presentation, a reflective log, and there's an end of module assignment. And we have the schedule for those assessments here as well. And you can find these activities directly in the week of study, or we also linked them here as well, so you can always kind of shortcut straight in. Now these deadlines will also populate your personalized calendar that's on your dashboard, so you'll be up to date with any deadlines that you need to meet within the module. You'll also be receiving feedback on these assessments throughout the module from your lecturer, and the lecturer will provide you a grade and feedback within 7 days of the deadline for these assessments. And that's really important because you can apply that feedback to subsequent assessment points. So you're constantly developing throughout the module. There is an additional resources page, and really this section is for any wraparound material that might not be specific to a week of study. So for example, you can access the entire reading list for the module, and you can access the grading criteria. So you can quickly, just within a couple of links, access those useful resources. And these are always in the same place. So when you start your next module, you don't need to kind of go searching around from a consistent layout from one module to the next. Okay, so I'll go into week one in this module, and each week has a particular topic. It has some introductory text, a learning outcome or learning outcomes. And then as I scroll down the page, there's a series of activities for me to work through as a student. And this really is where the variety in the content comes in. And Louise mentioned this in her presentation. So first of all, we start with a lecture cast. So as a student, I simply click on the title of the lecture cast. And just to give you a bit of context, the lecture is, it's an online version of a lecture, really. So rather than giving you an 1 hour long piece of video of someone lecturing through some slides, we've broken that content up into a format that suits more appropriately with online learning. And it looks something like this. So we start with some introductory text and a menu of content. And as we click begin lecturecast, we'll be able to start to work through this content. So first of all, we've got some learning outcomes, an introduction to what is health psychology. And as I work my way through, we'll be introduced to different formats of media. So it may be that we link to resources here. We might embed video. In fact, if I jump ahead a little, we also produce this content. So here is an example of some video. I'll just play this for a few seconds. I'll just mute that. So the audio narration there is going over the back of this video. But we would present this video material in a variety of formats. It might be that we use some animation on the screen. It may be maybe simple text on the screen like we've got here. It could be video footage. It really depends what the content is about for how we present this to students. There's variety in the content and it's visually engaging. But it gives students a variety of content as they work through this material. So this is a short example of a lecture cast. So to go back to the module, we're back in week one, and I've got lecture cast there. As I scroll down, we'll look at the other activities this week. So there's a student-led seminar. I'm not going to go into the detail of each of these, but this will hopefully give you an overview of what's expected each week. So there'll be a particular topic each week that's covered. This one is about disability studies. There's a skills-based workshop. So again, there's some resources here. And then actually, just after the workshop, there's a collaborative activity here where we ask students to bring through materials and share them and comment with each other. And as I work down to the end of the week, there's also the reading material. So if I click on the week one reading, instead of just giving you a long list for the whole module, what we do is we break that list up by the weeks as well, so that we identify reading each week that we think would be useful for that particular topic. And also give you a bit of context to why we believe that's useful. And at the bottom of each of these pages, you'll find a link here to reading lists at Liverpool, and that actually takes you directly to the University of Liverpool library, where you'll be able to access these resources. Just a brief note on that library. The online library has hundreds of thousands of journal articles and ebooks and resources, and just an incredible resource for the online students. You access both the learning platform and the library with the same set of credentials, so it's a nice sort of seamless transition between the two. A really useful resource for students to access. Because it's so large, that's why it's really important that we give you this direction within the module to what we recommend the reading should be. But we'd also encourage you to read around that as well as you work through. And then as I work through the weeks, if I go into week 2, you'll see there's a different topic, different learning outcomes. There's some consistency in the format, so we have a lecture cast, but we might also have, for example, a discussion forum. So in this example, there's a discussion forum, and in a discussion forum, students would be encouraged to answer or respond to a prompt, and then over a period of time, and they're encouraged to respond to each other and animate that, that discussion. And this is where Louise was referring to this, the lively debate and the lively exchange of ideas, and that's what happens in these discussion forums. So hopefully that gives you an idea about how we present the content and how you would work through that content each week, and gives you an idea about what the learning platform looks like and what some of the content looks like. I'll be here till the end as well, so happy to take any questions as they come through. But for now, I'll hand over to my colleague Joe, and Joe's going to talk us through the admissions process. So thanks for listening.
Okay, Joe.
Great, thank you. Hi everyone. So yes, my name's Joe and I work on the admissions team for the University of Liverpool's online programmes. So I'll talk to you about the admissions and enrolment process for this programme today. So as you can see on the slide here, we have a step-by-step kind of guide as to the whole admissions process with the University of Liverpool. And really the first place to start is to get in touch with our admissions team if you have any questions about the programme or any of the processes at all. So you can get in touch with us through a number of different methods. So through our general email, our number, our live chat systems, or by completing an inquiry form on our website there. And we can take our details from you, and you'll be assigned a personal admissions advisor who will then in turn contact you and go through any questions or concerns that you may have about anything to do with the programme. If you're ready to go ahead and apply, then you will need to complete our free online application form. Submit your details and the documents required for an application, and then that will come straight through to our admissions team. And once we have all the appropriate documents from yourself, your application will be reviewed by the head of admissions and the director of studies. And we do really aim to get an outcome on your application within 10 working days of that being submitted, so it can be quite a quick process. Once you have an application which has been approved, then you will be invited to conduct what we call a pre-enrolment review. And this pre-enrolment review is just a 10 to 15 minute telephone conversation with your personal admissions advisor. And in this call, they'll just confirm your offer of a place, go through the student commitments and the next steps of the process too with you. Once that has been conducted, you'll receive your official offer letter from the university, and then it would just be up to yourself to formally accept that offer and pay your deposit as well. And then you'll be all good to go on your chosen intake. So in terms of entry requirements for the MSc in Health Psychology, we do require all candidates to have a minimum of a 2-1 classification degree in the subject of psychology, and this needs to be equivalent to a UK bachelor's degree as well. Furthermore, applicants do need to provide evidence of the English language ability, and this does need to be equivalent to an IELTS academic score of 7.0. In terms of tuition fees for our MSc Health Psychology programme, the full programme fee is currently 18,000 Great British pounds for the current academic year. However, the university is currently offering a 15% scholarship for all students on the current academic year as well. And since it is available for all students, there wouldn't be anything you would need to do on your end. Instead, we will automatically apply that scholarship amount for you when you get that offer letter from us. So that 18,000 will be reduced by 15%. Furthermore, for students who are living in England and Wales, you may also be eligible for a postgraduate loan from the Student Loans Company in the UK. So that can contribute quite significantly towards your fees as well. So it's a good option for those students who are eligible. But we also offer monthly payment plans available as well for students, so it can help you spread the costs of the tuition fee throughout the entire duration of the programme as well. So a little bit more about the payment methods for this program. So that program fee that I mentioned on the previous slide is fully inclusive of all costs for the program. So we would never ask a student to go and self-fund any material or anything they would need to perform successfully on the program. All of the material resources, access to the learning platform and library are all fully included in that course fee mentioned before. And for students who do want to go ahead and pay the tuition fees in an upfront amount, they would also be entitled to an extra 5% discount on those fees. And that is on top of that 15% scholarship I mentioned previously as well. So it would be an extra discount for those students who pay upfront. Your tuition fees can be easily paid through the university's online payment portal. You can pay how you want, so bank transfer, debit or credit cards, and it's facilitated through this portal for quick and easy payments, and it's easy for you to track your payments as well. Once you start the program, we do offer a 21-day money-back guarantee. So if you start the program and decide it isn't quite right for you, you would be able to leave within those 21 days and get your full money back on the deposit there. So if you are ready to apply for this program, as I mentioned previously, you apply directly to the university, and you can do so by following the link provided on the slide there. And the application form is very easy to find on our online programs website. And if you've had talks with an admissions advisor already, they will likely have sent this link out to you as well. But when it comes to applying, you'll need to complete your personal details, as mentioned before, but you'll also need to submit this list of documents for your application to be considered. So the first thing we have on that list is just a scanned or photographed copy of your photo ID. And typically we would accept, well, most commonly accept a passport or a driver's license for this. Underneath that, we would also need an up-to-date CV. We would also need copies of your educational certificates. So this would include the certificate and also the transcripts which are awarded alongside them. We would need a short personal statement of around about 300 to 500 words or so. And we would also need 2 letters of recommendation. And these can either be academic or professional. So academic, it could be a tutor from your previous institution, possibly a dissertation supervisor, or if you're working in the field, we would accept a recommendation letter from a supervisor or a manager, or just somebody in your role that you report directly to. And they can either come directly to us, or they can come to us via you. And finally, as mentioned before, we'd also need evidence of English language proficiency. So IELTS and TOEFL would be the most commonly accepted ones, but we do also offer a wide range, accept a wide range of other English language certificates as well. And it's important to note at this point, if you have any concerns about the documents needed, whether you're eligible for the program or anything to do with that, then our dedicated admissions team are more than happy to talk through those concerns with you and give you the best advice, whether you're about to apply or if you've already submitted an application and are just waiting on a few documents. So just really to reiterate that, if you're wanting to get in contact with us, you can do so on the following link, and our team will be more than happy to talk through any questions that you have. Again, the application link is there as well to our application form if you are ready to apply. And for those candidates who do want to start on the January intake, our application deadline, that's application and all documents, would need to be submitted by the 15th of January. Of course, we would always advise to try and to do that as soon as possible, maybe before Christmas or just after, so we can process your application quickly. But at least, you do have that 15th of January deadline if needs be. And then we would be able to welcome those candidates starting on the 26th of January, once the rest of the application process has been completed in time as well.
Great, thank you for that, Joe. So at this point of the webinar, we'll go to take any questions that attendees might have. So you're more than welcome at this point to use the Q&A button, which you'll see down the bottom of the screen. If you move your mouse or your cursor, you can type your questions in there, or there's also the chat. You're more than welcome to type any questions into the chat. And we've had a number of questions, I think, already coming through already. So I'll just go to those and read out what we've had so far. And as I say, more than welcome at this point to ask any questions that you have. So there's a question that's come in from Jess, perhaps one that's best placed, I think, to be answered. Let me see here. So hi all, just wondering if there is a mix of synchronous and asynchronous sessions, and if so, what the proportion of each is, and the types of sessions which are likely to be synchronous or asynchronous. Louise, is that one that you could answer?
Yeah, absolutely. Thanks, Jess. So many of the sessions are asynchronous. You know, we have students all around the world taking this program and already kind of signed up, and that's what we would expect. And it would be a lot to ask people to be available at a very specific time of day or to do lots and lots of group work. So we do want students to get together in groups occasionally. That might be once or twice per module. There's the option we always have of either small group work where you can arrange with people when is convenient for you, paired work, or if none of those options are appropriate for you, to actually work a bit more closely with the lecturer and they can be in your pair. But it's important to us that none of the content that's delivered synchronously is kind of essential for you to be able to pass. So, you know, it is an online programme. Everyone does have the chance to study whenever they can fit it in and find it best works for them. So we want to keep most of the sessions asynchronous. So that's the lecture casts, as Stephen has gone through, they're to do in your own time. Many of the student seminars are to do in your own time. There might be the option to perhaps work together. There might be an option where you are asked to work together, but actually that's a contribution to something that you can make at any point in the week. So you might contribute to a discussion board together, or that kind of work, which can be done at different times. So yeah, most of it is very flexible. The lecturer does have office hours, and they will be set, you know, each week. But also they're available at many different times of the week. What we ask the lecturers to do is to arrange their office hours to suit the students who are on the course as well as their own work. So, you know, that's a kind of discussion that will be between you and the lecturer who teach on that module. So we do everything we can to facilitate people working independently, but we do see that there is value in working together sometimes. So one example I have is in the qualitative module, which is the 4th module. We would ask students in the classroom to interview each other. So you've got quite a few weeks to interview each other, and you need to do a couple of interviews. If that is not possible, we do have a bank of interview resources that you can draw on for those students that find that too tricky. So we're always trying to think of a plan B and a plan C.
Great, thank you. We've had a question from Teo in the chat and also in the Q&A, the same question. And Teo would like to know, Louise, if the BPS accreditation is certain before embarking on the process, as that's crucial in terms of career. So is there a point where we will be able to confirm, I suppose, to prospective students on that accreditation? Yeah, that's right, Teo. It is crucial for people who want to go on to stage 2, and, you know, I fully understand that. I can't offer that certainty because it would be irresponsible for me to do that. The BPS have had our application since August. I am in contact with the person who deals with the application on a weekly basis. She has told me that we will have the application back with the comments within 2 weeks, and those 2 weeks are up tomorrow, which is unfortunate for you today. But perhaps we can feed back to you when we have those comments. The University of Liverpool, as I said at the beginning, we're very confident that we will get BPS accreditation. We have that for all of our programmes. And if the BPS have flagged anything that is unusual or something that we hadn't expected, we will be doing everything that we can to rectify that and to meet those standards. Now, what can happen is the BPS flag something unexpected, or maybe they flag nothing unexpected and we turn it around really quickly, but perhaps it's not ready to have that stamp for the 26th of January. In that case, the accreditation would be backdated. So it would be likely that the students, if we got to that point, which we don't want to get to, but if we didn't have that stamp of approval by the 26th of January,
it's very likely that we will backdate it for the students that started on the 26th of January. So I can't say for certain because it wouldn't be responsible to say that, but we're very confident in having that approval.
Great, thank you, Louise. There was also a second question from Teo that came in through the chat. It might be perhaps one for you, Joe, asking what support is there for students who will be studying with Student Loan England?
Yeah, so for students who are wanting to fund their tuition fees through Student Finance England, it's important to note for the current academic year, the most that you can apply for from them is 11,222 Great British pounds. So there will still be a little bit of difference between the full fee and that. So part of the programme will still need to be self-funded. But as I mentioned before, we do have those monthly payment plans available to help kind of disperse the costs throughout the programme as well. Any kind of support you would need with a student finance loan, the admissions team is happy to help you with how to apply for a loan. And then, of course, Student Finance England themselves will be able to help with any application questions too.
Great, thank you, Joe. There's also a question coming, I think it's perhaps best for you as well, Joe. Just wondering whether there is an application deadline for an August or October start.
Will be, but you don't have to worry about that too much at the moment. So the August and October deadlines, well, the start dates will be at the beginning of each of those months. So we would say really for a deadline to try and apply around about 3 weeks before those deadlines really. So for August, if you were to apply by kind of mid-July, you'd be absolutely fine. And for October, if you applied around about mid-December, again, you'd be absolutely fine. So try and work towards those kind of dates.
Thank you, Joe. A question from Chrissy, Louise, asking, is there a research project?
There is a research project, and that is a 60 credit project, so it's quite a substantial part of the Masters. We have dissertation advisors and lecturers who specialise in dissertations with online students and who've had many years of experience in doing psychology online dissertations. Ethics approvals come through the University of Liverpool as they would for an undergraduate or any other masters that we were running on campus or online. And students are encouraged to, come to us with your ideas about what might be most suitable for you. You might have professional interests, you might work in a particular area. We also have lots of ideas of our own. We have health psychologists and clinical psychologists teaching on this programme. We have all our lecturers have PhDs in a health psychology related area. So it might be that you don't really mind what you do, but you find out that someone's doing something in diabetes or in chronic pain or in eating behaviour or whatever it is. So health psychology is a real strong point with the Liverpool staff, and we've recruited some brilliant lecturers. So, kind of scope and topic wise, we have a wide range of options for you there.
Great, thank you. And Joe, Chrissy asks as well if there's going to be a 15% discount in September 2021.
So at the moment, we don't know, as nothing has been confirmed. The current 15% discount is currently only active for the current academic year. So that would end with the August 2021 intake. And we would find out of the 2021-22 fees as they're reviewed annually around about the same time. So we would find out if that 15% discount was carrying on to the next academic year fees around about August or September next year.
Thank you. A question again from Teo, Louise. Do we offer student placement work experience? Is it part of the programme?
It's not part of the programme, no. We wouldn't be able to offer that in an equitable way across everyone worldwide, and it's not a requirement of the Masters. It's much more of a requirement of stage 2. So work experience, there's always opportunities within Liverpool and the Department of Psychology to assist lecturers. We call them internships, and there's no reason why students on this programme wouldn't have the same chance of doing that and contacting lecturers to maybe do some ad hoc work for them. but there is no placement. There's no kind of work experience that's a formal part of the programme.
Great, thank you. Another question, Louise, from Temi, and asking, when you're a fully qualified health psychologist, what title do you hold?
It depends. So this is an interesting question. It depends how you get your health psychology qualification. So I can only talk about the qualifications in the UK. So in Scotland, if you do the health psychology doctorate, you would leave with the doctor title. In England, if you do a health psychology doctorate in a university, you would leave with a doctor title. If you do the health psychology doctorate, which is called the qualification in health psychology through the BPS route, which is the route that I took, you wouldn't get the doctor title. However, lots of people at the moment are doing PhDs at the same time as their doctorate. So you might do a PhD before your health psychology training or after your health psychology training, which would give you that doctor title. There's no barrier to health psychologists working in practice or research or lecturing or anything if they don't have the doctor title, because the crucial thing is they have the doctoral qualification and they have that skills and knowledge. But the BPS route, which is the independent route, does not give you that title currently.
Great, thank you. Now again, I'll just remind people, if they have any questions at this point, to use either the chat or the Q&A button to ask those questions. Just a couple of questions that I think we had before the session, Louise. And one of those questions was, how does the programme link with the programmes on campus at Liverpool?
Yeah, so there's loads of ways that we link in. We treat our students as one kind of a cohort of important people, important students, and there's lots of kind of additional parts to the campus teaching and student experience that's open to the online students. So we have things like journal groups, we have them regularly, they would be at a set time, but we're going to encourage online students to attend those. We have belongingness events where we have kind of social events. We might watch a film together and discuss. You have a psychology related panel, so some clinical or health psychologists discussing the psychological aspects of the film maybe. We have quizzes and all that kind of social stuff that the online students are encouraged to attend. We also have the experts in the field on campus writing this material and developing this programme. We've got the best people doing that, and we have lots of them who are health psychologists and who are also working in the NHS as well, so have that practitioner perspective. So the contribution is they work on this programme as much as they do on the campus material as well.
That's great. There's a question coming from Teo asking, Louise, if there's a difference in professional status, I suppose payments, grade, etc., between those with the doctor title and those without?
Not as far as I know, no. The qualification of being a health psychologist is the most important thing. As I said, the friends that I've got and myself who did the independent route, we actually either did a PhD at the same time or after or before, so we have that status anyway. There's certainly no difference in pay for people as long as they are health psychologists. Now, there might be a difference if you have a PhD as well, because obviously you have that dual kind of skill base, because you could work in a research environment at a doctoral level or in a clinical environment at a doctoral level. So that would increase your pay. But to be a health psychologist, to be a practicing health psychologist, it wouldn't matter if you did a doctorate in a university or you did it through the BPS.
Great, thank you. There's a question coming, a couple of questions from Yash over the chat, Louise. And Yash is asking, does any educational pre-qualification needed for it? I'm an IT engineer. As per formal education, am I eligible? And then the second question is, after this MSc, what is the route to becoming a health psychologist as per NHS requirements?
Okay, so the qualification for this programme, Yash, is a 2-1 in psychology. So we do have a prerequisite. We need you to have a psychology degree, and we need you to have that at a 2-1 standard. Now, if there was a very particular reason why you didn't achieve a 2-1, I can look at that and we can have some discussion over that. But by and large, we need people to have a 2-1 in psychology. No matter what other experience you've got, that would always be brilliant, and an IT engineer is certainly not prevented in any way, but you would need a psychology degree. After this master's, there's another way to do that as well. So we have a conversion course which is starting in the summer, and what you can do there is it's called a master's in psychology, and it's in brackets a conversion course. And what happens is people that don't have psychology degrees can take this master's, which then makes them eligible as if they have a psychology degree to go on to do further study. After this MSc, if you were eligible and did have a psychology degree, the route to be a health psychologist in the NHS is that you take the stage 2 qualification. So this is the taught component of the health psychology pathway. And for stage 2, you have 2 years of full-time or up to 4 years of part-time work-based experience and some more training depending on what course you choose. So other universities run this course, and as I said, the BPS run it. Once you've completed stage 2, which is a doctorate, you're then a health psychologist and you could go and work in the NHS. And I expect that a newly qualified health psychologist would start on a band 7 salary. So what is it? I'll just continue your question, Yash. What a 2-1 is a grade of your degree. So you would need a 2-1 classification in a psychology degree to be eligible to take this course.
Yeah, just following on from that as well, Louise. So for those candidates who haven't got a degree from the UK, we're aware that in other countries we use different systems for grading. So if you're ever unsure as how your GPA matches to the UK equivalent, just discuss that with the admissions team, as we've got our own kind of tables and resources where we can match that GPA across to the UK framework too.
That's great, thank you, Joe. A few questions coming through on the Q&A, and Temi asks, Louise, for you to do a doctorate in health psychology, do you have to first do a master's?
Yes, yeah. This master's, stage 1 master's, is an essential thing. You cannot do the doctorate without the master's. It has to be done first.
And Temi also asks, Louise, if you go through the doctorate course at a university, you can still work in the NHS?
Yeah, absolutely. So there's the doctorate course at university and there's the BPS, and they're the same. They're the equivalent. So you can choose either a doctorate course or the BPS route. The doctorate course will give you the title doctor, and you will then be a practitioner health psychologist, and you can practice in the NHS. The BPS route won't give you the title doctor, but you're still a practitioner psychologist who can work in the NHS. Yeah.
Great, thank you. And Teo asks, Louise and Joe, at the moment I'm undergoing an MSc Psychology conversion programme that is BPS accredited. Is there any concession for people with MSc degrees in applying for this programme?
If by concession, Teo, you mean like an accreditation of prior learning, there's not. No, this is the whole master's needs to be taken to fulfil the BPS requirements and the requirements of the master's. So there's no accreditation of prior learning or recognition of prior learning in any way. If it's a fee issue, that would need to go to Joe. I don't think there's any reduction in fee if you're taking a conversion course.
No, there wouldn't be any reduction in fee now, because this would be treated as a different programme. Yeah, I'm not too sure how to elaborate on that.
Joe, if you have a follow-up question, Teo, please put that into the chat or the Q&A. Yeah. Hopefully we did answer that one, but if you do have a follow-up question, please do put that in the Q&A. And Emma asks, what is the difference between a PhD and a doctorate?
So a PhD, Emma, is a research-based qualification, So you are a doctor of philosophy, which effectively means you're a doctor of problem solving, and it can be in many different things. So you might have a PhD in psychology or health psychology. You could have a PhD in public health or health service research or mental health or clinical psychology or counselling. There's lots of different PhDs that you can have that might be really relevant to the work that you do as a health psychologist. And a PhD is a requirement to become a lecturer. So if you want to stay in academia, or you see yourself working in research in academia or teaching, then the PhD would be the basic, it sounds crazy, but the basic requirement to get a job in academia. The doctorate is the requirement that you need to practice as a health psychologist in a clinical setting. So my role is a split role. So I am the programme director of this course as a lecturer at the university, and that's where my PhD is helpful. And then my doctorate is helpful because I practice clinically in the NHS and work with patients. So both is, fancy and brilliant and great to have, and more people are doing that at the moment. But the PhD is largely research focused, and it's for teaching and for academia, whereas the doctorate is for clinical practice and behaviour change interventions and private therapy.
Great, thank you, Louise. There's been a question from Ashik in the chat asking, what are the core and elective modules offered in this programme?
So we don't have any elective modules, they're all core modules. So we start off with the fundamentals of health psychology, like an introduction. The second module is a quantitative research methods module. The third module is cognitions and illness beliefs. The fourth module is qualitative research skills. Then we have lifespan and socio-cultural perspectives, behaviour change interventions, professional issues, long-term chronic illness, and then we have our empirical project, and all of those are core modules. There's no options for you with that.
Might relate to another question actually I see in the Q&A, Louise, where I've had a question, is the module of pain included at any point in the course?
So the module of pain isn't included. We don't have a pain module, but we do focus on pain at a variety of points throughout the programme, most particularly in the chronic illness. So we look at chronic illness, which is module 8, long-term conditions and chronic illness. We focus on diabetes, childhood cancer, adult cancer, HIV, and throughout each of those weeks, we touch on pain. So we do have teaching on pain, and we do focus on pain, but there's not a module of pain.
That's great, thank you. There's a question, Joe, here. An international student would like to know if the 7.0 IELTS is a requirement, even if I have a bachelor's degree from an English-speaking country, such as Australia.
Yeah, if you have a bachelor's degree from an English-speaking country, you wouldn't need to provide an IELTS certificate. That would be your evidence of English language, the degree would.
That's great, thank you. Teo asks, Louise, can you go straight to doctorate from this type of MSc?
Yes, you can, absolutely you can. This is exactly what we expect a lot of our students to do, to be honest. You have stage 1 masters, which is this. It's not quite stage 1 yet, as we've discussed, but by January we very much hope it will have that BPS stamp, and then you go to your doctorate straight from this, no problem.
The next question from Temi, Louise, when applying for a doctorate at a university, what kind of experience would you need to be a good candidate? Do you need a lot of field experience?
I don't think you do, no, to be honest. I think any experience would be beneficial, any kind of work in support roles, healthcare assistant roles, but then anything more widely where you're working with people and you're supporting people would be really useful. The gold standard of kind of experience in the UK is definitely the assistant psychologist post, and people typically have a few of those. But that won't be a prerequisite to get on a doctorate. That would be a nice to have. So I'm sure that people can go straight to the doctorate, because this is actually what the admissions tutors will be looking at, whether you've got your stage 1. And it's very similar to us. We're very excited and interested when people have a real range of experience, but actually what they have to have is a 2-1 in a psychology degree. And similarly for the doctorate, what you would need is a stage 1 master's, not necessarily experience.
Great, thank you. And we've got a question here, Louise. How much leeway do you have in your research project in regards to the area of study, methods of study, etc.?
As long as it's health psychology related, we will be able to find a lecturer to support you, as long as it's ethically appropriate. So there's those 2 things. We want it to be health psychology related. We want you to consolidate some of the learning that you've had throughout the programme, and we want you to build on those research skills that we've taught you and you've learned about. Obviously, we will need ethical approval, so it needs to be ethically appropriate and feasible. We don't want people to aim to interview 50 people. We will be happy with 10, and we need to make sure it's achievable. But it's very much your research project, so we're very happy for you to have a very broad or a very niche area of health psychology that you want to look at further. As I said, all our lecturers who supervise the dissertations are so experienced, and they're really fantastic, so I'm sure nothing would faze them. But definitely for the first port of call is that it's yours, and it's yours to develop how you wish.
Thank you, Louise. A question from Chrissy asking, do you cover autoimmune disease in chronic illness module?
I would need to check. So I can't answer that today, Chrissy. I don't think we do, but there may be parts similarly to pain that we include in different chronic illnesses. So no, I don't think we do.
We perhaps could confirm that for you, Chrissy. I can take
absolutely.
the question away and confirm that to you. And again, I'll just remind people at this point, if you've got any questions, just to use the chat or the Q&A button at this stage to ask those questions. Just going back to perhaps a couple of questions we had before we started, Louise. One question was, how many hours a week will I need to study on the programme?
Yeah, so the programme is set in such a way that we have 8 weeks of teaching, and then we have a couple of weeks break, and then we have the next 8 weeks of teaching. And in each of those weeks, it's the same for every module. You have an hour of lecture, so that there's an hour of content. You have 2 hours of student-led seminar content, so that might be reading, working together, thinking about things, maybe writing something down or a synopsis of something. You then have your 1 hour workshop skills. So that will obviously take an hour. So there's 4 hours of kind of taught content that you need to be really engaged with. And then we recommend that students have up to 10 hours of reading a week. Now, I will leave that with you all. There is lots of content that you're very, encouraged to read and to look at further. 10 hours might put some people off and they just wouldn't have that time. That's completely up to you. But to make it a BPS accredited programme, it needs to be around 14, 15 hours a week of content. So lots of that is in the extra reading.
That's great, thank you, Louise. And that Emma asks as well, how many years is the programme? This is the Masters.
Programme is 2.5 years.
And another question, Louise asking, is this course primarily designed to prepare you to work in a hospital setting as a health psychologist? What can I expect to learn if I'm going to be working outside of a hospital setting?
So it's not primarily designed to help you work in a hospital setting, but it will help people that want to do that. It will help people that want to go on to work straight away after the Masters and work with patients, maybe in a therapeutic setting, not as a psychologist, but as a mental health practitioner of some nature or a physical health practitioner. But that isn't the primary design, really. It's to give you the skills and knowledge to have master's level information and skills around health psychology, and it's the start of a process which enables you to become a qualified health psychologist if that's what you wanted to do. So we don't expect everyone to want to be a health psychologist. This course, is appealing to many different people doing many different things. So if what can you expect to learn? All the same things as everyone who wants to work in a hospital setting. Chronic illness is probably which is the final module, particularly looks at kind of hospital settings because of the nature of the module, but there's lots of other ways that you can use this as well. You could work in research, you could work in teaching, local government, charities, health promotion work. There's many different places that you can work, not just hospitals.
That's great, thank you. And Emma asks, if I'm currently in my third year, when would I apply for this course?
So that's up to you, Emma. I mean, you could apply for the September intake if you finish in, June and July, or you could apply maybe for the next January intake and have a break, maybe, hope to find some paid work or, so that's up to you, but you would need to have finished your undergraduate degree. So it would be September onwards, 2021.
And Teo asks, Louise, obviously we said it's a 2.5-year programme, and it's a part-time programme, Teo. Is there the possibility of finishing sooner?
Yes, so it is a part-time programme, Teo, and only one module runs at one time. So sometimes master's programmes may have, say on-campus ones, might have up to 4 modules. So you might have 4 modules in semester 1, 4 modules in semester 2, and then your empirical project. Other masters might have 2 modules that run alongside each other, either online or kind of face-to-face teaching, and that might be part-time. We actually run our programme 1 module after each other. So it's 8 weeks of one module, then a couple of weeks of a break, then 8 weeks of another module, and that's why you've got 8 modules to get through, and then you've got your empirical project. The empirical project is kind of the equivalent of 4 modules in time. So that sort of takes you to the end, so that there isn't a possibility of finishing sooner now, but there is a possibility of it taking longer, and that's absolutely fine with us. So you might want to stop after a couple of modules because for some reason the next few months aren't going to be good for you, and then you can pick up where you've left off and carry on with it. So it can take longer, and we're very kind of happy with that and open for students to talk to us about that. That's no problem.
That's great. And again, I'll just remind people you can ask questions at this point. There's the Q&A button that you'll see towards the bottom of your screen, or there's also the chat. If you've got any questions, please type those questions in, and we're happy to look at those at this point. I'll just give another minute or two for more questions to come in. And I think another question we had a little bit earlier, Louise, was what kind of support is given to students, be it personally, academically, on the programme? What kind of support is available there?
We have loads of support. It's a really nice programme to take in that way. We have a whole student support team that are just concerned with supporting students, and we have student support advisors who will be your personal advisor throughout the course. We have myself and another director of studies, another programme director who's also a health psychologist, and we're always going to be available for students to get in contact with us. We also have your lecturers, so as someone said earlier, there's probably going to be a different lecturer for every module, because we want the best person to teach you that module aligned with their expertise. And I know from meeting them already that they're very supportive people. Obviously, as health psychologists, and we've got a clinical psychologist as well, it's our business to be supportive professionals. So you know, there's a wealth of kind of support there for people if they need it.
That's great, thank you, Louise. And another question that's come in, Louise, is this course going to be online for the foreseeable, or is it only during COVID that things are going to be online?
So it is an online programme, and you know, at the moment lots of the Liverpool courses are running online even though they're campus courses. I said at the very beginning that we've been running online only courses since 2006. So this is not just a COVID thing for us, this is the way that this course will be run, and many other masters as well going forward. So this will always be online, and this will always be the offer for you, that it's fully online. So it's different to some universities which are kind of putting things online for now. That is the case for some of our programmes where we have students actually in Liverpool trying to take courses that they're already enrolled on, but that's not the case for this course. This programme is an online masters, and it will always be online.
Great, thank you, Louise. And another question asking, is there an alternative course which is like this but full-time?
There are in the UK, not that the University of Liverpool run, and not that, you know, we run online, but that there will be other masters in health psychology across the UK. Yeah.
That's great, thank you. I think I'll just give another minute or two if any more questions come in. I'll just let you use the Q&A or the chat to do that, and just check I've not missed anything that's come in. Another question we had, Louise, again, just before the start of things, and you might have covered this perhaps in a recent answer actually, but what is the benefit of the course to students who aren't perhaps quite sure about the next stage?
Yeah, it's a really good question, and actually sometimes students take courses like the Masters in Health Psychology. Sometimes if they're unsure, they might take something around mental health, if they might want to do clinical. And also students really like taking the Research Methods Masters courses, which are also, you know, really, really valuable. I would say this is the best option out of those three, simply because it gives you that option of going into health psychology. There's no masters that gives you the option to automatically get onto a clinical course. And the Research Methods Masters, although very valuable for people that maybe want to stay in academia and are definitely convinced about that, that won't help them be a health psychologist either. So because we have 2 modules on research methods and we have our empirical project, this has got plenty of research in, yet it gives you that option to straight away choose to do a doctorate or to go down that pathway of health psychology. So it's useful for anybody that's interested in physical health, well-being, mental health, improving health and illness, and it also gives you that additional option in the future.
That's great. There's another question from Emma. I don't know if it'd be, again, you best placed to answer this, Louise, or perhaps Joe or Stephen. And Emma asks, with the course being online, are we still able to use facilities on campus, like the library?
I think I'm going to pass that to Stephen.
Thanks, Louise. Well, all students have access to the online library, and they have the same set of credentials that a campus-based student have actually, so they can access the library, but also a lot of resources that surround that. I think we'd have to get back to you whether they can access physical resources. I'm not sure actually, but they would have access to everything they'd need to complete the program. So everything you'd need to complete your studies, you'd have access to online. Whether you can go to the campus in Liverpool, I'm not sure, Emma. I'm sorry. We can certainly find out and follow up though. So we'll do that.
Yeah, we'll follow up on that for you, Emma. Just looking to see if any more questions are coming in. There's nothing else at the moment. I'll just have a look if there were any questions beforehand again. A couple more questions are coming in. And Teo asks, does the university have a doctorate in health psychology that the student could go in for straight after the MSc?
Today we don't, Teo, but that is on our list to develop, and we're really motivated to do that. So potentially by the time you finish in a couple of, 2.5 years, we might have one. We hope that we're going to have one, but currently we don't have one. We do have a doctorate in clinical psychology, and we do have obviously the independent route through the BPS, and many of us, myself included, another health psychologist, I think there's a couple of us, can supervise students who want to do that route. So, you can contact us after the masters to be supervisors for that route. But at the moment, the University of Liverpool doesn't have that doctorate.
A question here, Anonymous asking, in comparison to completing an on-campus health psychology course, is there an experience that is inevitably lacking because of that?
Yeah, so we've tried our best to make the answer to this no. There's a difference, isn't there, working online? We all know that now. We've done it all of this year, whether we've liked to do that or not. And there is a difference. There's that kind of shared experience maybe is a little bit different. But the programme that we have here, we've worked so hard to make that difference really, really minimal. So we have loads of opportunities for students to engage with each other, to engage with staff. We link into lots of the on-campus extras. So I said journal clubs and social aspects and lectures and guest speakers, and all that is going to be able to be accessed for you as much as the campus students. The other health psychology masters that are on campus that I know about, they don't have placements either, and they don't have work experience, and they don't have opportunities for students to go out practicing their health psychology. So in that way, we're no different. That is very much something that happens in stage 2 of the health psychology pathway. So that comes after you've completed your masters. So academically, I don't think there's any difference. It would actually suit a lot of people, I think, to be able to have the material that we're offering available to them whenever's convenient. And I understand that there is a difference in that kind of student maybe relationships with each other, but we're doing everything we can to really enhance it for you and your experience in the best way that we can.
That's great, thank you, Louise. Again, I'll just give another minute or so for any more questions to come in. If you have any questions, please use the chat or the Q&A to ask those questions. I'll just look back and check I've not missed anything that's come in. Okay, I guess nothing else seems to be coming in. So I guess what I can say at this point is thank you to everyone for attending this afternoon. Thank you to all of our presenters today. A recording of this webinar is going to be made available to everyone who registered. So I'll be sending a copy of that out to everyone in the next few days. If you do have any questions in the meantime, please do contact the team via our website, and you can see the link on the screen in front of you. And obviously, we hope to welcome many of you onto the programme in January. So again, thank you everybody, and I hope you enjoy the rest of your afternoon. Thank you.
Thank you.
Thank you very much.
Thanks.